can start with the anatomy of the skin. So, as you all know, the skin is composed of three layers: the epidermis, dermis, and subcutaneous tissue. The outermost level, the epidermis, consists of a specific cells known as keratinocytes, which function to synthesize keratin along a thread-like protein with a protective role. Okay, so skin is the longest organ of our body, and the skin has a protective function. Okay, and it maintains normal tone of our body, and the dermis beneath the epidermis. It contains tough connective tissue, hair follicles, and sweat glands. The deeper subcutaneous tissue, otherwise known as hypodermis, is made of fat and connective tissue. And regarding the lubricants of the skin, we knew that in the skin there is sebaceous gland, right? So sebaceous gland is a microscopic exocrine gland in the skin that opens into a hair follicle to secrete an oily or waxy matter that is known as the sebum. And this sebum that lubricates the hair and the skin. When we are saying, okay, one patient skin is very oily, that means there will be accumulation, or the person may have suffering from the acne, okay, or some may very dry in nature. So during the winter period, the skin will be dry and it may damage. So according to the sebum productivity, we will say, or we will classify the skin as an oily nature or dry nature or in the medium or whatever it is. Okay, so the lubricants, that is known as the sebum. Then next is the cells of the skin. Usually the epidermis contains keratinocytes, melanocytes, Langerhans cells, and Merkel cells. Anyway, this epidermis that will help to regulate our body temperature. So that's regarding the skin. Now we can move on to the history and physical examination of the skin. So here what you are assessing is, you are collecting the data from the patient. So usually which all are the data you will collect? You will, if you are seeing one patient with a skin disorder, firstly you will ask how long it occurs. Is there any problem with this lesion, and is it change or shape or size is increasing? Do you have itching or redness? And what is the exact problem you are here? And is there any aggravating factors for these lesions? Is there any precipitating factor for these lesions? Okay, so you will ask all these questions, and is the patient have any allergy? Then what you will do next? You will do the physical examination as usual. If you are doing physical examination, you have to know some lesions, that is especially regarding, you have to know regarding the skin lesions. So skin lesions mainly two types: primary lesions and the secondary lesions. So now we can move on to the primary lesions. Primary skin lesions are abnormal skin condition present at birth or acquired over a person's lifetime, and secondary skin lesions, that is result of irritated or manipulated primary skin lesions. Okay, for example, if someone scratches a mole until it bleeds, the resulting in lesion and crest, now it become a secondary lesions. We may hear, don't touch the acne, or don't touch the skin lesions, or don't irritate the skin lesions, because it becomes secondary lesion. Now we can start with the primary skin lesion. So primary skin lesion, the name indicates that it occurs primarily due to any of the infection or any of the pathology. Okay, so the first skin condition that comes under primary skin lesion is macule. Macule means a flat lesion that is less than 1 centimeter. Example is freckles. Freckles in Malayalam we will say pulligal. Okay, so most of the persons they will have the macule in their body. Okay, and it is not a problematic one. Just understand that if the lesion is flat and it is less than 1 centimeter, and the color, most of the color will be brownish appearance or blackish appearance, so that is known as the macule. Okay. Next one, patch. Patch means flat lesion that is more than 1 centimeter. Example, vitiligo. In Malayalam, what is the Malayalam of vitiligo? Vellapand. Okay, so in that patient you can observe there will be patchy skin lesions. Okay, so all over the body their skin is changing. So that patches will be long, more than 1 centimeter. So that's why it is known as the patches. Next lesion is papule. Papule means elevated solid lesion that is less than 1 centimeter. You should remember papule is elevated lesion that is less than 1 centimeter. Example, elevated moles, blue nevus. Then plaque. Plaque means circumscribed, elevated, superficial, solid lesion that is greater than 1 centimeter in diameter. Usually, example is psoriasis, seborrheic and active keratosis. You just understand, example for plaque is psoriasis. You will study later regarding the psoriasis. Okay. Next skin lesion is known as the vesicle. Vesicle means fluid containing lesion that is less than 0.5 centimeter. Usually vesicle is circumscribed superficial collection of serous fluid. Okay, so vesicle, you should remember there will be a fluid collection. It will be less than 0.5 centimeter. And the good example for vesicle is chickenpox. Next lesion is bulla. Bulla means fluid-filled cavity that is more than 0.5 centimeter. So here in the bulla there will be fluid that is more than 0.5 centimeter. Example is bullous pemphigoid. Another example is burns. Okay, in burns usually we can see bulla, fluid filled cavity that is more than 0.5 centimeter. Next one, pustule. So the name indicates pustule means pus containing lesion. So here there will be in the lesions there will be pus. Example is insect bite. Okay, another example is acne. There will be chance for pustule. Next lesion is cyst. Cyst means encapsulated cavity lined with epithelium that contains fluid or semi-solid material. Example is cystic adenoma. Nodule is a dome-shaped lesion. It can be endophytic or exophytic in nature. So endophytic means it may be a bacterial or fungal origin that may persist within one area of the body. Okay, but exophytic means it may not be bacterial or viral origin, but it may have the tendency to spread from one area to another, and it may have the cancerous origin too. So example is basal cell carcinoma, and the nodule, it will not be always a cancer, and it may be occur as a skin mark. Some may have the nodule in their nose, or some may have in the earlobes, but it is not a cancer or carcinogenic. So here you can see wheals. Wheals means an evanescent edematous elevation of skin caused by dermal edema. The simple example of wheal is mosquito bite. Okay, after the mosquito bite, you may see a small round elevation that is known as the wheal. Okay, and it may occur as an allergic reactions too.